It is 9:06, Thursday, April 9th, and I'd like to call the meeting of the Humboldt County Board of Health to order. If we have a flag there, Dave, would you join me in the Pledge of Allegiance?
Yeah, one moment here. Getting that, Commissioner. And then let me share here. Or not. Well, it's not sharing for me here. You might want to go forward, Ken.
For this meeting, Eunice, we don't have the flag up. We'll dispense with the Pledge of Allegiance, and we'll call for public comment. Do we have any comment from the general public? It is designated for discussion only. The public has an opportunity to address the health board on any matter not appearing on this agenda. However, no action may be taken until the matter's been put on the agenda. Do we have any public comment? Hearing none, we will go on with the first item, which is updated from the public health officer, local emergency manager, public information officer on county response to the COVID-19 coronavirus. It's for information only, presented by Dr. Chet Stringham, public health officer, Captain Sean Wilkin, Humboldt County Sheriff's Office, and local emergency manager, and Nicole Maher. And I'll turn that over to you, Dave. I don't know who wants to go first there. So
Chairman Tipton, this
yes.
is Mike McDonald. For the record, I think it would be helpful if we could get a roll call of the board members to identify who's participating and ensure that we have a quorum.
Okay, perfect. Would you do that for me, Dave?
First of all, Commissioner Cherry.
I'm here.
Commissioner Brissenden.
I'm here.
Commissioner French.
Here.
Commissioner Bell.
I'm here.
And obviously you're there as well, Commissioner Tipton. So we have all five on the call.
Okay, then we have
the sheriff.
I'm sorry. Yep, the sheriff. Are you on, Sheriff Allen?
Good morning. Can you guys hear me? I am having some issues, but are you able to hear me?
We hear you.
And
And Dr. Stringham?
Yes, I'm here as well. Can you hear me all right?
Yes.
Yes.
So we have a quorum.
Okay. We have a quorum. We'll move on to this agenda item, and turn this over to you, David, to call on who you want to first. I assume Dr. Stringham.
Yeah, thank you, Commissioner Tipton. First of all, just want to thank everybody for joining today. Currently, we have 32 in the room, and hopefully, we'll give you some additional information here, some updates on our coronavirus here in Humboldt County. I want to start with Dr. Stringham to provide an update from his perspective and give us an overview of where we are. And Dr. Stringham, also, obviously, I'd like you to talk a little bit about some of the other things that we've launched this week, and we'll cover that. If you forget anything, I'll try to fill in the blanks for you. So I'll turn it over to Dr. Stringham.
Excellent. Thanks, Dave, very much. Can everybody hear me all right?
Yes.
Okay, perfect.
Yes.
Yeah, good morning, everybody. So I'd like to start my comments this morning with an invitation like we did last week, and want to define what I think this board's most important task is right now. I think the most important thing that we can be doing right now is to help to motivate the people of Humboldt County, and not merely to educate them, but also to provide reasons and context and the motivation required to actually do the things that we are outlining here. I think there are too many people who are still worried about this virus and who are not focusing on the right things. And it's my opinion that what we need to do as a board is to provide something that's very sticky, that's easy for the public to digest and easy for the public to use in order to become motivated. And a patient was in my office several days ago, and he jokingly said, "I wish I lived on a deserted desert island, because if I did, I wouldn't have to worry about this at all." And it caused me to think about something, and I'd like to present that to the board this morning. And that is that if we actually did live on a deserted desert island, we'd have nothing to worry about. This virus would not be dangerous to us. I don't know if anybody's ever considered that. You'd be thousands of miles out to sea, and the virus would be no factor. And in fact, if you lived only 2 or 3 miles out to sea, you'd still be okay. And if you lived only several hundred feet, in fact, if you lived only 20 feet out to sea, you'd still be perfectly safe from this virus. You would not get this virus. Every single one of us has the capacity to give ourselves the advantages that we would have if we lived on that desert island by staying away from other people. And that's what I'd like everybody to think about this morning. That's the message I'd like to deliver to the public. I hope it's sticky. I hope it's easy to remember. And I hope it causes people to be motivated to do the right things. Next, what I'd like to do is talk a little bit about the updates, Dave, that you've talked about, and kind of bring the board up to date on what's going on. We've had several more cases since we visited last week, and now we're to a total of 16 cases here in Humboldt County. And we've had 15 diagnosed within the community, and we've had one who has come in after having been diagnosed in an outside municipality. We have one visitor so far who is not a resident of Humboldt County, has really nothing to do with Humboldt County, and was traveling through, was diagnosed here, and is in respiratory isolation. So that brings you up to date on where we stand at this point. Hospitalized patients, so far there have been a total of 3. We've had a number of emergency department visits, resulting in 3 different hospitalizations, 2 of whom were transferred to Reno, and one was admitted last night to Humboldt General Hospital. So that's kind of where we stand as far as the epidemic here in the community goes in terms of numbers. I'd like to bring you all up to date on what's going on with some of the projects that we talked about last time also. So I'm very excited about a new project that's just gone into effect this week, and it's called the Humboldt County Volunteer Health Educator Program. And this is a team of approximately 10 people, and every one of us has a different specialty and knowledge base. Some are comprised from EMS, and some are with the State Health Division. There are a number of different people who've volunteered their skills in order to help the community, not only to spread the word, but also to make sure that we're complying and give recommendations and just be kind of the eyes and ears and the mouth for our organization. The mission is primarily to visit businesses and other entities to make sure that those people are doing the things that they need to do, but also to get information from them in order to be able to share that information with other entities. We're very excited about it. We had our very first meeting this week. I think this went fantastically, and I'm looking forward to working with these folks. Assignments for various businesses to be contacted, which will mostly be done by phone. Those were made yesterday, and we're coming up to speed on this. So we have a number of different arms. We also have an email address that's been set up in order for concerned citizens to call in to make recommendations or to give reports of things that they're seeing that they think may be dangerous and grounds for our attention. And that email address is covid19@humboldtcountynv.gov. And I'll say that again at the end of my comments so that people can write that down. We'll be getting the word out on this very quickly also. Second thing is the mask program, which I'm very excited about. And Leanne Robertson is going to be making some comments this morning, I understand also. Leanne's group, Mucka Mask Makers, has just been a fantastic partner for us in this fight. Really appreciate the work that she's doing and the work that each one of the volunteers that she helps to coordinate are doing as well. I'd like to point out that masks are not just an effective way to fight this virus in terms of spread, the communicability, but the other thing is that the masks are a wonderful way to keep this problem in the forefront of the public's mind. We need every single person to commit and to engage and do the right things. And masks are not only a great way to stop viral spread, but they're also a great way to ensure that people never forget what we're up against and that it's not possible to disengage because everybody sees these conspicuous devices here in the community. The third thing I'd like to talk about is the Facebook presence that we have. There are a number of different sites that are in effect that service Humboldt County. And the website or the Facebook page that I've put together is Stop Coronavirus in Humboldt County Now. And we have just reached approximately 35,000 actually individual hits on that site. So I think the word is really getting out. We're doing various other media coverage. And so it would be remarkably difficult to be in our county these days and not know what's going on. So I think we're doing a great job through the work of various people who are working on this program. The featured article this week was things that people are able to do in the community in order to help engage those who are not engaged. We essentially have two groups of people within our county. The vast majority of us have engaged, are doing the right things, are doing wonderful things in order to assist. But there still are people who have not yet engaged. And that's really what we're trying to cover on this particular Facebook presence and through various other techniques. And the other thing, of course, is that the Volunteer Health Educator Program is primarily, the primary mission is to cause those who have not yet engaged to do so. The fourth thing is that we are in the process now of setting up a Spanish-speaking presence, and Nicole Maher has graciously translated everything that's been said on Stop Coronavirus in Humboldt County Now, and all of that information is now available through Nicole's assistance in Spanish. And so everybody who speaks Spanish or may feel more comfortable speaking Spanish than English is now able to gain access to the exact same information. And Griselda Soto is going to be helping us to have a much larger presence within the Spanish-speaking population here in Humboldt County, and we're working on that right now as well. I'd like to make one final comment about hospital readiness and also the status of the auxiliary field hospital. I'm very excited about our capacities. I think we've had a wonderful ramp up of potential services, and the hospital is doing a fantastic job. I think things are going very, very well there. And I'd again like to invite the citizens of Humboldt County to do all the right things so that a lot of the things that the hospital and other healthcare officials here in Humboldt County are doing in order to keep us safe if things don't go well. I'd like to invite all of you to do the right things so that those things won't be necessary. Everybody can do well as long as we all do the right thing. I'd like to close my comments by drawing attention to something that happens here in Humboldt County virtually every year, and that is we're threatened by wildlands fires. And when the firefighters and other officials are not busy fighting those fires, they're very busy cutting fire breaks, and those are widened areas of evacuated land, strip it of the vegetation so that if a fire comes along, that fire does not have the fuel that it needs to propagate. And that's why we don't have to rely on other firefighting techniques that may be more dangerous and less sure of working in order to keep everybody safe. And this virus is really no different from that. If every single person in our county does the right things, then every single person becomes their own personal fire break. If you don't get the virus, then you're not capable of transmitting that virus to anybody else. It's something I hope everybody will think about. And thank you very much for your time.
Okay, Dave, are you back on?
I am here. Thank you. So I did get a message here that people are unable to hear Dr. Stringham. Is that accurate for most people? Do we have folks chime in?
Hear him loud and
I can
clear.
I hear
I
him
can
loud
hear
and
him just
clear.
fine.
Okay,
I can
all
hear.
right. It could just be that individual then maybe. So, okay, well, thank you, Dr. Stringham. I really appreciate it. There's a couple people I'd like to turn to here. Leanne Robinson, I think you're on the line here. I don't recognize your number, but can you just tell me if you're on the line?
I am on the line.
Thank you. Hey, would you just give us, tell us a little bit about what's happening with your group, how it started with the Mucka Mask Makers, and where you're at today, and give us a little background on that. I think it's a great human interest story with respect to how our citizens are responding and helping us to deal with this virus. So I'll turn it over to you, Leanne.
Thank you for having me this morning. It all got started I just asked a question on the Winnemucca info page. I knew that the N95 masks would be kind of swallowed up by the metropolitan areas, so I knew we were going to be needing something. And I just simply asked if the hospital would be interested in homemade masks of any kind to either cover up the N95 masks that they had to prolong their life, or if they just, if anybody just wanted them. And I had about 60 people from the community respond to that comment that they would be willing to help. And one of the citizens that contacted me was Jace Edwards from the radio station, and he said, can I possibly do an interview with you? And so I did the interview with him, and he helped set up the Facebook group that we have. He came up with the Mucka Mask Makers, and his IT guy helped set up the group, and it kind of just grew from there. People joined the group, and people volunteered to help sew. Todd Hagness, that works at the junior high school, volunteered to cut material using the laser cutter at the school. He got permission to do that for us. I have a couple ladies now that are just solely making straps and bias tape to make straps with for the masks. And then I think there's probably 20 to 30 people. I don't have an accurate count of how many people are sewing, but so far we have reached right at 850 masks in the last about 10 days.
That's great, Leanne. My thanks personally, and also I know the board as well. It's in times like this when people like you and those individuals that have come on board, really step up their game. And I know that I'm hearing from many different places that people are really happy to have these things delivered to them. It really puts their mind at ease. And again, can't thank you enough. So appreciate you and all the folks that are involved with you.
Well, thank you very much. I'm happy to do it and happy to be able to coordinate the effort right now.
Thank you, Mr. Chair. I'd like now to ask, I believe he's in the chat room or in the meeting, Harold Goodmanson from PC Internet. Harold will be moderating a television show tonight, and I am not exactly sure how this is going to come down and how people can get into this to see it. Dr. Stringham will be on that television broadcast along with myself, I believe Dave Jensen from the school district, Sean Wilkin from the sheriff's office, and one other I just forgot. But in any case, I wanted Harold to just chime in here and give us a little background on this and how people can join that broadcast tonight. Harold, are you in? Yeah, looks like he has not come in yet. So at this time, why don't we just go ahead and throw it over to Sean Wilkin? Sean maybe can give us an update from his perspective.
Good morning, Dave. Can you hear me? This is Sheriff Allen.
Hey, Sheriff, how are you?
Good. Sean stepped out. Now he's back in. But just real quick from me, over the weekend, I received an email from an individual who didn't live in this area but does have relatives in this area. Within the email, it stated that people have heard around town that the National Guard is going to be deployed to Humboldt County. I just want to clear that rumor up that the National Guard is not being deployed to Humboldt County. We have not made any official request to that our resources are tapped out and we would need them. The governor did activate the National Guard in some other areas to assist with the COVID-19, but I just want to clear up that the National Guard is not being deployed. We had not made a request for them to come into the county. On another issue, we are receiving some complaints that some businesses are not being compliant. We are working with the district attorney's office to determine if these businesses are essential or not. But if the public out there who's listening in do want to lodge any complaints against any businesses, just feel free to give us a call at 623-6419 and we'll take a look at it to determine if they are essential or not. And then one other thing, you guys were talking about the mask earlier, and I just want to send out our appreciation to Kathy Wolfsteller, who is a sheriff's office employee who works over at the jail. Back in early March, she actually made a request to have everybody within the agency some masks made, and I believe it was last week that these were distributed throughout our agency. And we really appreciate Kathy taking this on her own. And we do have some of the deputies who are wearing these masks on a regular basis now. So thank you, Kathy. And now I'll turn it over to Captain Wilkin.
Morning, Dave. So in the emergency management side of things, probably biggest accomplishment since our last meeting, the offsite hospital is up. We did set up our mobile command center for setting up an incident command center there. We are still participating in a daily governor's briefs and meetings with Nevada Department of Emergency Management. Resource requests that we have submitted have been filled to both HGH and City of Winnemucca, so they're getting PPE in from the state level. We're waiting some more of ours for our agency at the county level to come in from the state. So, things related to things within the agency and what we're doing with our deputies, PPE and stuff is in place. We've got things distributed to our deputies for working in the community. Our community partners, I'm waiting a LEPSI call now. We've continued to work with our community and non-governmental organization partners to keep them informed, to keep them up to date throughout the community. And Dr. Stringen and I have been communicating on a pretty regular basis about things that are going on, try to make sure that we're keeping first responders and other people in the community safe. So things have been great with working with the state. They are getting the things out to the county and the city that we're asking for. They are being very receptive to us. And lastly, probably one of the more important things is we also got a letter of intent submitted to the state, and that will help with recovery and mitigation funding later down the road from the state's disaster declaration fund. So that any of it we needed, that could be huge back to our county. And I submitted that on Tuesday of this week. So, and I think that's pretty much it for new updates from where I'm from our last meeting.
Okay, I don't know where Dave went. This is Marlene.
Marlene,
Yeah,
this is Nikki from Human Services.
Yes,
there were
Nikki.
there was quite a group of us. We went in on the link from the calendar, and apparently it was the wrong link. So we just now joined this meeting. So we've missed the first half hour, unfortunately.
Oh my goodness.
Yeah, so we're all coming in now, but so if we missed anything, if you can give us a brief summary, that would be wonderful.
Okay, and
Thank you.
no
Marlene,
problem. Yes.
Do you guys have any questions for me from the county commission as far as emergency management and what we're doing or our communication with the state or anything like that?
I do.
Ken
Yes,
does.
sir.
I do, Captain. I talked to you briefly yesterday, but just to bring the public up to date, I would like you to comment on why you chose the event center for the off-site hospital.
Yes, sir. So the reason for choosing the event center for the off-site hospital, we're actually establishing the temporary structures within a structure. The off-site hospital allowed us adequate parking. It allowed us to be able to hook up travel trailers and RVs for HGH staff or medical staff that may be working down there. The very design of the building allowed for a good environmental design for a medical facility. It allows to have a single point of entry for patients coming in. It allowed to have an ambulance entry on one side of the building as well as a decontamination exit on another side of the building. It is climate controlled inside, and where it's set up, to give people an idea, the bleachers and everything that rolled back gave us a large concrete surface that allowed HGH to come in and clean and sanitize that surface for the purpose of putting up the buildings. The tents that are being used inside are the same ones that they use at Burning Man, so they're large. And it gave us plenty of parking for people, and it also allowed us to set up the incident command center as well as maintain security on that facility as well. And it's pretty close to a direct line drive from HGH to that facility. So the location, just by the basically environmental nature of it, worked out very well. And with the county being able to do this, we're able to do it. We didn't have to enter into a lease agreement or some kind of other agreement with people. And it also keeps the public away from that in the event that we do have COVID patients there.
Thank you very much. I appreciate that, Captain. I would like to remind everyone that that missed part of this meeting, that were in on a different link and couldn't hear, that this meeting is being recorded, and Tammy will have a recording of it, so you'll be able to get that from her.
Well, Mr. Chairman, and Dave may be able to fill them in as well for a sooner response to what went on at our meeting.
Certainly.
So, Mr. Chair.
Yes, go ahead,
Dave Mendiola for the record. So that recording, we can actually do that within minutes. So what we'll do is we'll put it up on the website. So for any of you who came in late, you can go to the Humboldt County website, hcnv.us, and click under the COVID virus warning at the top, and you'll be able to see the recordings for all the meetings so far. So that will be available, probably 15, 20 minutes after the meeting. Okay.
All right. Thank you.
And it looks like Harold is in now.
Yes, he is. So at this point, Harold, are you in?
Yes, I am.
Thank you very much. So Harold, could you just give us an overview of the television production tonight and what's going to take place and how people will have access to that?
Yes, absolutely. Thanks for that, Dave. Yeah, so what we're going to do in conjunction with the National Grassroots Broadcasting Network and Humboldt Sun, our new affiliate here in Winnemucca, we're going to have a live town hall meeting this evening. Probably already know the participants. A lot of them are on this call. What the intent here is just to disseminate all of this COVID information and preparations and plans and direction to our local community, our citizens of Humboldt County, of Winnemucca. And what's going to be like is basically it's a virtual town hall. So I will be hosting. We'll have our participants, and we'll have a brief conversation with those. And those participants will all have about 5 to 7 minutes to talk about the things that they're doing and the things that they're sharing with the local community. After we finish, each individual panelist has their opportunity, then we'll have a question and answer session. We are going to moderate those questions. At this point, it does not look like we're going to have the community live asking those questions. It's going to work out better. The other thing that we want to make sure of is we want to make sure that we have the conversation in control in the direction that we want to head it. The intent of this is to be 100% positive. This is going to be quite different than things you might see on mainstream media where there's traps set and there's intent to make people look bad. None of that is what's going to happen tonight. This is going to portray our community, our leaders in the most positive light, and it's going to really be great information for all the people who really aren't aware of the things that are going on. Really, one of the keys to it is that people need to be able to attend and need to be able to see this, and there's going to be multiple ways to do it. People that would like to watch on their television, their smart TVs, Apple TV, Samsung TV, Roku, and Amazon Fire Stick, they can download the app NGBN. That's National Grassroots Broadcasting Network. That's one method that people can watch. Another way is we're distributing a web link via the Humboldt Sun's Facebook page where you can just click and open in a browser, and it will be displayed. And we will also stream it live on the Humboldt Sun Facebook page. So we have multiple methods for people to view the broadcast. It will obviously be recorded and can be replayed, at any time in the future. And that's really the short version of what we're doing and what's going to happen. What questions does anyone have?
Harold, this is Marlene. First, I guess it's the most obvious question, but what time is it?
7 o'clock.
7 o'clock. And if one does not have Facebook at all, how can I get that link onto just my computer?
That's a good question. I'll have to find out how we can get that distributed out. If there's an email list, maybe, Dave, is there a way that we could, distribute that through the county's lists and communication systems and stuff? It will just be just a URL that people will click on and be able to see it in a browser.
Yeah, I mean, I guess let me get a clarification, Commissioner Brissenden. So are you saying somebody has no access to the internet? Is that what you're saying, or just Facebook specifically?
Just Facebook specifically, but also the people that don't have access to internet, I mean, they're going to be not able to see it, but no, Facebook specifically.
Yeah, so they got two options. Either they download the Facebook application so that they can, like I say, go on and find that, or you can just go in, as he said, through the Humboldt Sun's webpage. He mentioned two things you can do on the Humboldt Sun's webpage. One is go in there and see the live stream through that, or you can go through the Humboldt Sun's Facebook page, and they don't have Facebook. So that would be, sounds to me like the only way that you'd be able to do it, unless you had a smart TV. Like he said, you could download an app on your smart TV, which would allow you access into it as well. So.
Okay, thank you.
So with respect to your question, Harold, I'd be happy to put anything on the county website, maybe a little information on there to say, hey, here's how you can access this television broadcast. So if you just write something up for me and send it over to me, I'll get it on there.
Absolutely, I'll do that in the next couple hours, Dave. Probably, I'll have my partners at the Humboldt Sun probably write it up and get it over to you.
Perfect.
And Harold, I'd just like to thank you for all you're doing, keeping Winnemucca strong. We appreciate it.
Well, thanks for that, Marlene. I'm just one member of this community who gets up every day and tries to do good, just like everyone else on this call and lots of people around this county. But thanks for the accolades.
You're welcome.
Yeah, thank you, Harold. Commissioner Tipton, I'll turn it back to you.
Oop, he's on mute.
I think you're on mute, Ken.
Okay. Yeah, is that better?
There you go.
Our second item is Public Information Officer regarding the current status of Humboldt County response to the COVID-19 virus, including but not limited to the latest number of positive cases in the county, the status of those patients, as well as updates regarding the efforts to mitigate the spread of the virus. In addition, the group will update the board regarding dissemination of information to the public through various methods. And I think most of that done, but if you have something else you'd like to add, Dr. Stringham, feel free to do so.
Hey, Commissioner Tipton, also your audio is not very good at all. It's kind of broken up. So I'm not sure if it's just your link to the network, or you were good earlier, but all of a sudden it's not so good. But yeah, so Nicole Maher, are you in? It shows you are, but I wonder if you could unmute your mic.
Can you hear me?
There you go.
Yes.
Okay.
Could you provide us just an update, Nicole, from your perspective as public information officer, where we're at? The one question I have that's outstanding we have not talked about is the hotline that we're going to join, I believe. I just didn't, maybe give us an update on that and anything else you can think of.
You bet. The hotline is coming through Elko County, and they have graciously invited us to participate. So in all, there will be 5 counties who will participate. It's being staffed by medical students from the University of Nevada, Reno, and they are providing guidance for patients who call in. They have quite a expansive checklist that they go through to identify if patients likely have COVID-related symptoms. For Humboldt County, our guidance will be for them to go through our screening clinic at Humboldt General Hospital, the West Campus, and we'll be able to guide them there and also answer questions. And Dr. Stringham has been great about working with both the hospital and also with Bryce Putnam, who is Elko County's health officer, to make sure that we're involved in that. So we're hoping to start sharing that information a little bit later today. It's a toll-free number for our residents. The other things that we're working on are, as Dr. Stringham mentioned, we have 3 main Facebook pages. So we, with ABLE's help at the county, we are using the county's Facebook page for just general posting, latest information, things like that. Dr. Stringham's page, which is Stop Coronavirus in Humboldt County Now, is just excellent. He's sharing just really important information about the direction that he would like our county to take. He's very engaged with that page. He's answering people's questions, and we'll actually be asking people as they have questions to post them on that page so that they can get those answers. I'm hoping as that page continues to roll out, and as he said, we've already got quite a presence on that page, that we'll be able to take some of those questions and answers and share those in other places. Like Commissioner Brissenden said, not everybody's on Facebook, and even some aren't on the internet. And so we want to make sure that we provide platforms across the spectrum for people to receive that information. And then, of course, our newest offering just came up yesterday. It's called Humboldt COVID-19 Español, and that one is just an informational page for our residents who feel more comfortable in Spanish. And so we're just trying to kind of brainstorm some ideas of getting that out to the community, going through some of the churches, going through the school district and their free and reduced lunch people as they pass out those lunches every day. I'm hoping that we can get some information out, and then sending that through El Sol, which is a Spanish language newspaper, and then some of the other kind of influencers in our community, like Dr. Stringham said, Griselda Soto, and of course, ABLE at the county and others who will be so helpful. And while Dr. Stringham is so kind about my translation efforts, I did grow up in Uruguay, so I kind of cheated. I've always known Spanish, but ABLE is the man when it comes to translating, and I'm just so appreciative of him. I've done little bits and pieces there, but he's translating those big pieces, like those press releases, and making sure that our folks stay up to date. And so I think we're going to make a great team. Mostly him. Let's see what else. I'm just working on a couple of drafts that I'll be sending over to Dave and Dr. Stringham. One is a postcard that would go out to all Humboldt County addresses, and that would just have all sorts of information, everything from the hotline to the Facebook addresses to certainly the county address where people can go and pick up all of those press releases. Our big Humboldt County report, the link to that, the one that goes out every day that has a bit of an update on all boards in the community. And then just that main messaging from Dr. Stringham. We are just still trying to really push that social distancing. It's just, Dr. Stringham talks about sticky kinds of things, and years ago, kind of my sticky was I had a terrible car accident with I was pregnant with my fourth and had 3 of my other children in the car. And I just remember as those NHP officers came and we had rolled so far off the highway that they actually had to bring out a semi-truck tower to try to reach my car. And it turned out to be okay. And they said, and I just remember one of those officers saying it was just the result of a simple click, that I had clicked a seatbelt, and I had clicked a seatbelt for every single one of my children. And that's the way I look at this, the sticky with the 6 feet of distance is such a simple thing that perhaps people aren't taking it seriously. So we'll just keep pushing and pushing and pushing the simplicity and the beauty of that simplicity of just helping people to acknowledge and realize that it's just that simple of how to protect themselves and their families. Patty I think I mentioned this on Monday with the commissioners, but Patty at the Senior Center is just a wealth of information, and we want to make sure that we're touching base with our seniors. And so one of the things I'm working on today is a draft flyer that I want to pass by our group and Patty that we will begin sending out with the Meals on Wheels that are going out so that we can reach that group. Also received a lovely phone call from Karen Crutcher in McDermott, who is now working with our tribal elders and tribal citizens. And so we'll be doing some outreach with them as well, and just trying to identify in each one of our outlying communities different ways to reach out that perhaps, again, don't involve the internet or Facebook, or perhaps do. We just want to meet citizens where they're at. Excited about the TV program tonight and hope that we can continue to use that resource. I think, and just one last thing, we're just putting out press releases. We have a press release going out about the business outreach program that Dr. Stringham mentioned. And so we just want people to know that is not an enforcement program. It's highly based around encouragement and community effort, and also a press release going out today about our Spanish Facebook page. So any questions? Sorry, that was a load.
Nicole, this is Commissioner Brissenden, and I just want to thank you for what you're doing and for putting that postcard together and the flyers together, because that will reach the folks that don't have the internet and Facebook. And I thank you for that.
Well, thank you, Commissioner. And I just really think, in fact, Dr. Stringham, do you want to, I don't mean to put you on the spot, but do you want to tell them about the phone call you received from the state? That has nothing to do with me, but all of these other wonderful efforts that are going on, I think it's worth a mention.
Can everybody hear me? Excellent.
Yes.
I received 2 days ago a telephone call from the director for the state Health and Human Services Division, and he took the time to call us personally to thank each of us for the work that we're doing, and he thought that what we were doing was innovative and wanted to have some details to potentially use this in other municipalities. And the last thing he said was that he was going to be calling the governor to let him know what was going on in Humboldt County. I'm very proud of the things that are happening here. very proud of the work that's being done by everybody, but I'm most proud of the fact that we're all able to come together as a team and do the things that we do, but to apply those things to a situation that, if we didn't have that level of cooperation, would look very different. So wonderful job for everybody.
Thank you, Dr. Stringham.
Thank you, Nicole. Thank you, Dr. Stringham. David, have anything
Yes.
else?
Mr. Chairman, I don't have anything else to add other than just to mirror Dr. Stringham's comments. The efforts going on all over the county, some we've heard about, many we've not. And I just can't thank everybody enough. And to just continue to remind your family, friends, neighbors about the social distancing issue. At first, I know even for me, it was kind of a funny thing that, oh, hey, we got to stay apart. But the reality is that's our number one defense. And again, it's up to each one of us individually just to, again, go back to Dr. Stringham's original comments last week and his constant refrain, which is social distancing is our number one defense against this. So just really encourage people to take that up. And if you've got a local business that you frequent, take the time to go talk to the manager or the owner. If you see something that maybe they could be doing a little differently to ensure that we get the social distancing and that we, do everything we can to mitigate the spread of this thing. So it takes all of us. It takes each individual as well. So my thanks to everybody, and that's about all I have at this time.
Okay,
Dave,
ask,
commissioners, I do want to let everybody know that our Facebook page is not private. So even if you don't have a Facebook page, you could still view it. So the link is www.facebook.com/Humboldt County NV. And you'll be able to view any posts that we have on Facebook, just like anybody else would. You'll just have a little banner at the bottom that says to sign up. You don't have to sign up. You could still view all the info. And I'm going to go ahead and share Harold's link. So if anybody needs access to that, just refer them to our Facebook page. Even if they don't have one, they'll be able to view the post.
Abel, thank you. And tell me that website one more time,
facebook.com/Humboldt County NV.
Thank you very much.
You're welcome.
Okay, I'd like to, we've heard from Dr. String and Nicole. Now I'd like to see, does the sheriff have any other comments you'd like to add?
Yes, thank you. I just have a couple of quick questions here. We meaning law enforcement as a whole, all of, the Humboldt County Sheriff's Office, Winnemucca Police Department, Highway Patrol, all of us are put into certain situations where we have to break the 6-foot barrier. And if it does come back that we were around somebody who had this COVID virus, Dr. Stringham, would you recommend that we go ahead and get tested, or do you want us to wait until we're showing some signs and symptoms of being exposed?
Sheriff, thank you for the question. I think that we've had a few cases already where things like this have happened, and so what I've found is that there's a lot of misconceptions about the best strategy. So the first is, as you've said, in certain cases, the jobs that some of us have absolutely bring us by necessity within a 6-foot distance, or sometimes substantially closer to other people. And so my recommendation is that if a person comes within very close distance, the first thing I'd like to do is make sure that masks are worn as routine whenever practical. And the reason is because it gives somebody an extra degree of certainty, so that this way, if a person does need to come within that 6-foot distance, they already have that safety barrier that assists. And so certain things that can be done to mitigate those risks like that. And then the other thing, of course, is that sometimes in cases where it's a judgment call as to how close an officer might have to come, or a deputy may have to come to another person, to use that judgment to make sure that the closing of distance is absolutely necessary. And I realize in certain cases that it is. And then finally, to kind of get to the heart of your question, if an officer's work brings him or her into super close distance contact with a person, and that person has symptoms, then my recommendation is that that officer go into respiratory isolation until we can determine what happened. And we can handle each of these cases on a case-by-case basis also. And I've been in contact with both of our local agencies, Humboldt County Sheriff's Office and Winnemucca Police Department in recent events. And then the other strategy in certain cases is that if a person has overt symptoms, we can even have that person tested, the suspect who's contacted, that is, and so that the officers don't have to be tested. And then if that person is not COVID-19 positive, then the officers would know that they hadn't come into a threat at all. And so my invitation, of course, and I'm always available, that if there are any specific cases, feel free to contact me. I've been in contact with several officers and several administrators within both of our local agencies. And so I'm happy to help on a case-by-case basis as well. Does that answer your question?
Yes, it does. Thank you. Also, one more question is, and this is mostly on social media, I've heard people talking about a 5-day isolation period. Do you know anything about a 5-day isolation period?
You know, the standard isolation is 14 days for contacts that people have with folks who absolutely have tested positive. But the problem, of course, as you and I both well know, is that we look so hard to define things in terms of black and white, but there's so many different shades of gray. And that's one of the reasons why in cases where something's very clear, then we can kind of handle things by a decision-making matrix. But there have just been so many cases that are less than clear that's one of the reasons I'm happy to step in on an individual basis and hear the details, determine the story from everybody's perspective, come up with a risk assessment, and figure out what our best mode of action is.
All right, thank you. That's all I have. And once again, thank you for everything you do, and everybody else on the line. Thanks for all your cooperation through these troubled times. Thank you.
Thank you, Sheriff. Captain Wilken, do you have anything that you'd like to add or questions?
No, not at this time. No, I just concluded a separate phone call with our LEPC members. The local LEPC with our non-governmental partners, they're all working together. So with the different non-governmental organizations, American Red Cross, Civil Air Patrol, even the National Weather Service out of Elko is here participating in these things with us today. People in our community and these other ongoing working groups that we have under normal conditions have really done a good job of coming together. Emily Gould from Public Health and getting some PPE information and stuff out to us. So I do really want to say thank you to those people for all of the help that they're giving us, and the people in our community that are coming and working together on this. It's actually been absolutely extraordinary to see this.
Thank you, Captain. Marlene, do you have any other questions or anything you'd like to add?
No, I just want to reiterate what everybody else has said. Thank you to everybody who is involved in communicating and dealing first responders, first right front line with the COVID-19. We thank you for what you're doing and all the help you're giving our community.
Thank you, Commissioner Brisden. Commissioner Cherry, do you have anything that you'd like to add or questions?
Yeah, I have, I guess, maybe one simple question here, and that is in regards to the reports that we receive from Nicole and others. There are still several outstanding tests that we're waiting on results. Does that mean that we do not have the rapid test capability, and of supposedly 15 minutes or so you're supposed to know the results? And if we don't, is that something we are trying to get, that capability?
Dr. Stringham?
So the first is that the tests have come in within about 4 to 5 days previously. And the most recent tests that we've been getting over the last 48 to 72 hours have come in just a little bit faster than that. And Commissioner Cherry, I think the test that you're referring to is a new antibody test that we're going to be able to do. And I apologize, I was not able to attend the daily hospital meeting this morning. It's at 8 o'clock every morning. And but so I'm not sure if that was discussed at that particular meeting, but I can tell you that that we're in the process, hopefully fairly quickly, as in next week or two, I'm thinking, of being able to get that antibody testing capacity. And that will give us the capacity that you're talking to do rapid tests here on site, no need to send them out, and also to have better access to a larger number of tests, which I think could change our strategy in general. Is that the rapid test that you're referring to?
Yeah, that's it. I believe that's the one that I've, read online like everyone else that is they've just developed it. It's rather new, but they're trying to get it to as many communities, particularly communities like ours that are showing high instance of the virus.
I think this will be a game changer in all communities, but especially in our community where it's more difficult to get the tests, just the geographic distance into Reno to get them done. So I think it'll be a fantastic thing. I can report back to the board during next week's meeting to let you know exactly when that's coming. My anticipation is that it's coming very quickly.
Thank you.
Thank you. Commissioner French, do you have anything you'd like to add or any questions?
Yeah, thank you, Mr. Chair. I just had one question for Dr. Stringham. Are there other medical providers in the community or in the vicinity of our community that are taking independent tests and sending them to independent labs that we don't have necessarily coordination with at this point?
None that I know of. Let me just make sure. Yeah, none that I know of so far. We have only two independent practitioners in Humboldt County, and that's Dr. Robbie Grant and then me. And we're sending everything, at least through my office, sending everything through the hospital by design. And the reason is because it's much safer to do things that way. It gives one data collection point from a logistics standpoint, but more important, it causes anybody who may have this virus or has a higher probability of having this virus because they already have symptoms, sends those people to one place where we can contain risks of infection, where people have specific training, and it's just a much better way to do things that way. So I don't know of anybody who's testing independently, but there would only be theoretically one other provider who could be testing it. To the best of my knowledge, I don't think she is.
What generated this question was I had an individual in the community who's a minor who indicated that there might be testing going on from the Newmont or the Golden Valley lab or the Golden Valley medical providers for the mines, and that now that the availability of private testing labs are out there, not necessarily just a state lab, opened the doors for that question as to whether or not it's actually happening independent of the efforts from the West Campus.
What I'm going to do based on your question is I'm going to reach out to the clinic that's used now by the Nevada Gold Mines mining operation and determine the answer to that question. My presumption has been no, only because we've been orchestrating things ourselves, but maybe it's safer for me to call and get the information directly from them.
Thank you. I just thought it might be an opening for allowing people who may be symptomatic to get into our community without off the radar, so to speak.
Yeah, it's an excellent question, and I'll look into that and be able to let you know later today.
Thanks a lot, Dr. Stringham.
Thank you.
Thank you, Commissioner French. Commissioner Bell, do you have anything you'd like to add or anything you'd like to say?
No, I just want to reiterate what other commissioners have talked about, and that was to just say my thanks for everybody that's working hard on this, and that's all I have.
All right. Have I missed anybody else on the health board? I don't think so. So now I'd like to call for public comment. Is there any comment from the public?
I think we
This
have
is Nick.
future agenda.
This is Nikki Lynn.
Yeah, we do. Go ahead, Nikki.
Okay, I just wanted to say that sorry so many of us joined late, but apparently there were 2 different links to the meeting. So we will make sure that we only have one link to the next meeting so we can all be in it together. And I was going to ask Dave Mendiola to repeat what he said about the recording being available, please.
Yes, so we'll have the recording available within 2 hours on our website. And again, it's hcnv.us, www.hcnv.us. And once you get in there at the very top, there's a COVID-19 big red dot. You click on that, you'll go in there, you'll see all kinds of information that is in there and available. But we've got the recordings. Look under the County Health Board or Board of County Health. And there's recordings from last week people can listen to. And I would highly recommend, there's also one that's just Dr. Stringham's portion of last week's meeting. That's a great one to listen to. He went through about, 30 minutes of detailed information, and it was great. And then also you'll be able to hear today's meeting on there as well.
Okay, thank you. Anybody else? Well, let's back up just a moment here. We need to set a meeting for next week. Do we want to do that next Thursday at 9 o'clock?
Seems like the way to go, or on a consistent basis, that helps. So.
Okay, and then we will set the next meeting of the Humboldt County Health Board for 9 o'clock on Thursday, April 16th. Any other public comment this time?
And we will see, Ken, this is Paige, and we can get the address again on the website, correct?
Correct. That is correct, Paige.
Thank you.
Thank you, Paige. Okay, we're going to adjourn this meeting at 10:08 a.m. on Thursday, April 9th. Thank you, everyone.
Thanks, everybody.
Thank you.
Thanks, guys. Have a good day.
Thank you.